Did you know that you can control diabetes through diet? This can be achieved by the medical nutrition therapy MNT. MNT is a broad category of interventions that use nutrition to prevent and manage medical conditions. It involves creating personalized nutrition plans based on scientific evidence to treat and control medical conditions. MNT is crucial for diabetes management as it helps patients regulate their blood sugar levels, reduce the risk of complications, and improve their overall health. The primary goal of MNT for diabetes is to maintain balanced blood glucose levels by carefully monitoring the intake of carbohydrates, fats, and proteins. Various approaches, such as carbohydrate counting, glycemic index, and following a low-carb diet, can be used to achieve this goal. MNT for diabetes also involves educating patients about making healthy food choices, understanding portion sizes, and emphasizing the importance of carbohydrate counting. Collaborating with a registered dietitian is essential in developing an individualized nutrition plan that considers the patient's specific health needs, preferences, and lifestyle. Depending on the severity of the condition, MNT can be classified into different levels of prevention: primary, secondary, and tertiary. Primary preventive MNT focuses on promoting healthy dietary patterns to prevent the development of conditions like type 2 diabetes or heart disease. An example of primary preventive MNT is following the Mediterranean diet, which has been shown to reduce the risk of developing type 2 diabetes, cardiovascular disease, and certain cancers. Secondary preventive MNT aims to prevent the progression of a diagnosed medical condition. In the case of diabetes, secondary preventive MNT may involve monitoring and adjusting carbohydrate intake to manage blood glucose levels and prevent complications. Carbohydrate counting is a common type of secondary preventive MNT for diabetes, where the amount of carbohydrates consumed in meals is tracked, and insulin doses are adjusted accordingly. Tertiary preventive MNT focuses on managing the complications of a medical condition after they have occurred. For example, in patients with kidney disease, tertiary preventive MNT may involve reducing protein intake to slow down the progression of kidney damage. Similarly, in patients with diabetes-related neuropathy, tertiary preventive MNT may involve supplementing with specific nutrients to manage symptoms. Numerous studies have demonstrated the significant benefits of MNT for individuals with diabetes. These studies provide strong evidence that MNT plays a crucial role in the management of diabetes. For instance, research published in the Journal of the Academy of Nutrition and Dietetics found that MNT can improve blood glucose control and reduce triglyceride levels in patients with type 2 diabetes. The consensus report by the American Diabetes Association, ADA, and the European Association for the Study of Diabetes, EASD, published in Diabetes Care in 2022 included MNT as part of the overall management of type 2 diabetes that aims to prevent or delay complications and maintain quality of life in type 2 diabetes. The study emphasizes the importance of weight management and highlights MNT as one of the approaches to achieve this goal. Participants who received MNT lost more weight compared to those who received standard diabetes education, suggesting that MNT is an effective tool for weight management in this population. By providing personalized meal plans that consider calorie intake and nutrient balance, MNT can help individuals with diabetes manage their weight effectively. Weight management is crucial for diabetes management, as maintaining a healthy weight can improve insulin sensitivity and overall blood sugar control. In addition to blood glucose control and weight loss, MNT has positive effects on cardiovascular health in individuals with diabetes. Cardiovascular health is particularly important for individuals with diabetes who are at an increased risk of heart disease. A recent study published in Current Atherosclerosis Reports showed that MNT by dietitians is not only effective in improving health outcomes but also contributes to cost savings, making it a valuable approach in dyslipidemia management. By promoting the consumption of heart-healthy foods and managing overall dietary patterns, MNT can contribute to better cardiovascular health outcomes. Following MNT recommendations can help reduce cardiovascular risk factors such as high blood pressure, abnormal cholesterol levels, and inflammation. By providing personalized nutrition plans and education, MNT empowers individuals to take control of their health and make informed choices about their diet and medication timing. Through MNT, individuals may be able to reduce the need for medication or adjust their medication doses under the guidance of healthcare professionals. Improved blood sugar control, weight management, and reduced risk of complications can enhance overall well-being and lead to a better quality of life. Nutritional balance. MNT emphasizes the importance of achieving a balanced and nutrient-dense diet. This approach ensures that individuals with diabetes receive adequate amounts of essential nutrients, including vitamins, minerals, and fiber. By focusing on whole, nutrient-dense foods, MNT supports overall health and can help prevent nutrient deficiencies commonly associated with certain dietary restrictions or imbalances. Education and empowerment. MNT provides education and support to individuals with diabetes, empowering them to make informed decisions about their nutrition and lifestyle. By working with registered dietitians, individuals can gain knowledge about healthy food choices, portion sizes, and meal planning strategies. This knowledge equips them with the skills and confidence to manage their diabetes effectively and make sustainable dietary changes. By working with a registered dietitian and incorporating evidence-based MNT approaches into their lifestyle, individuals with diabetes can improve their health outcomes and reduce the risk of complications. When it comes to meal planning for diabetes, it is important to focus on whole, nutrient-dense foods and achieve a balance of carbohydrates, proteins, and healthy fats. Monitoring and controlling carbohydrate intake is particularly crucial, as carbohydrates have the most significant impact on blood glucose levels. The recommended amount of carbohydrates for a diabetic patient may vary depending on factors like age, activity level, and medication use. Adequate intake of protein, healthy fat, fiber, vitamins, and minerals is also important, which can be achieved through the consumption of fruits, vegetables, whole grains, and lean proteins. To ensure a well-planned and individualized meal plan, it is recommended to work with a registered dietitian. They can tailor meal plans to the patient's specific needs and preferences and provide guidance on monitoring blood glucose levels and making necessary adjustments. In summary, a well-planned individualized meal plan, focusing on carbohydrate management, healthy fats and proteins, and adequate fiber, vitamins, and minerals, plays a vital role in the management of diabetes through nutrition. Try Mekdar app for free and enjoy collaborating with a registered dietitian and following evidence-based recommendations to optimize your health outcomes and reduce the risk of complications.